Hello, this is Richard Chaet from Scottsdale, Arizona. I'm going to talk today about the cosmetic uses for Icon Resin Infiltration, which is manufactured by DMG. And how can you value this? Her smile is beautiful. And this is what we're always trying to achieve with any cosmetic result: a very happy patient and a very happy parent. So let's talk a little bit about some of the common discolorations. We all know there's white spot lesions caused by early caries, fluorosis, developmental white spots, and hypomineralized and hypoplastic teeth. The treatment options are many: bleaching, microabrasion, resin infiltration, and of these top three, any combination of either of them can be used with resin infiltration. Then you have bonding, veneers, and crowns. This is a slide showing the cosmetic kit of DMG. On the left you can see the instructions. So every kit has these instructions, so it's very clear what you should do and how you should do the procedure. You can see a tube which has a green hydrochloric acid. It's 15%. Then they have little brushes that are applicators that go on the tip of the green tube, or the tube on the far right here, which is a black tube which contains the resin. And the tube on the middle is the drying agent, with its ethanol. So this slide will show you that resin infiltration can cosmetically remove white spots in just one visit. Not all of them, but many of them. You can see the before on the left and the after on the right. Resin infiltration restores the tooth to its normal luster again by etching away the white spot lesion or the little stained spot lesion and replacing it with a resin that has a similar refractory index to enamel. This slide will show the removal of the pseudointact enamel surface on the tooth. So this is a control. This is a tooth treated with phosphoric acid, and this is a tooth treated with the 15% hydrochloric acid. And you can see the etch is pretty decent, at least 30 microns. And sometimes you do have to use multiple etches to remove the tissue. And here's what the surface looks like. This slide shows a photomicrograph of the depth of penetration of the resin. You can almost see the DMJ on the left side of your screen. White spots disappear. It's called color masking. And like I said before, the resin has a very similar refractory index to enamel, and it helps restore the luster to the tooth after you've used it. And here's another before and after slide showing you the results. This is done by Sebastian Paris, one of the inventors of the techniques. The CDT code for this procedure is 2990. It's resin infiltration of incipient smooth surface lesion. This is the same code as the interproximal lesion also. Anytime you do cosmetic procedures, you must get informed consent. You also always want to underpromise, because sometimes you can't remove all the stain or the white spot. Sometimes the white spot goes all the way through the thickness of enamel, and you have really no way of knowing that when you're starting. So you want to be careful about underperforming, and again reviewing other options just in case the patient is interested. For example, if it's not going to work, do you want to do a composite veneer or a porcelain veneer? I'm going to discuss the technique that we use to remove some of the white spots and some stain spots on facial surfaces of teeth. DMG recommends that you do resin infiltration as soon as possible after bracket removal. It just makes it easier to remove the white spots. If the patient's interested in bleaching, this is a great time to do it, especially if teeth have fluorosis or little brown spots on them. Always want to make sure before you start anything that the gingiva is healthy, and you always want to recheck before you schedule the patient. So in our practice, we'll do a quick check 2 or 3 weeks later before we schedule, because some of these procedures take over an hour, so we don't want to waste our time if the tissue is all bloody. Always take pre-treatment photos. You want to have a dry working field for this procedure. Non-thermoplastic rubber dam is the best for two reasons. It protects the tissue, but it also retracts the gingiva, which is super. Liquid rubber dam is also used. You can use Optical or Opal rubber dam. Nodal dry field may also be used in selected cases. You want to clean the teeth and ensure that the lesion is completely accessible. So if the lesion is 2 or 3 millimeters above the tissue, you can use liquid rubber dam. However, if the lesion is at the tissue, the gingival tissue, you want to use a rubber dam. Uncovering the body of the lesion is really where the art of this technique comes into play. Again, because you don't know how deep the lesion is in the tooth. Usually we'll at least etch a tooth once or twice for 2 minutes an etch, and what you do is you etch it for 2 minutes, you rinse and dry, you place your alcohol on the tooth, and if the white spot is gone when the alcohol is there, then you know you can do your resin. However, if you still see a lot of white or stain on this particular tooth, then you have to re-etch it again, or you may want to do some microabrasion or a light sandpaper disc to remove as much of the stain as you can. You have to be very careful because you do not want to remove too much so the surface becomes concave, which is a problem, and then you might have to do bonding on the tooth. This is a case that we did. You can see the white spots on the facial surfaces of 8 and 9. This is our etch with our HCl. And this is how we check to see whether we're ready to place our resin or not. So that tooth was etched at least 3 times and dried, and now we're placing the alcohol on. You can see that the white spots are gone. So now I dry it, and this is how we place our resin on a tooth. We just use a micro brush. Let it soak in for 3 minutes per tooth. We floss. We light cure for 40 seconds. We replace it again, and this is the before and after. You can see the white spots are gone now. This is a case, again, from Dr. Paris. You can see the before and after. This was a case I did a few years ago on teeth number 6 through 11. Here is the pre-treatment slide. And you can see we used the rubber dam, and I even used floss to ligate it so I could reach the lesion at the gingival margin. And this took multiple etches, at least 3 etches, and some microabrasion to get the result that you see here on the right, which came out really nice. You can see a little bit of sore gingival there, which heals in a few days. So thank you again,